Hi, my name's Jill, and welcome to Let's Talk About It. Today, I'm going to be talking to you about conversion therapy. Now, some of the content within this discussion may potentially upset or make some listeners uncomfortable, such as violence against LGBT people, homophobia, and human rights violations. So I suggest now, if any of these topics trigger you, then please stop listening. So, for those of you who don't know, conversion therapy, also known as cure therapy or reparative therapy, refers to any method of treatment or form of approach which has the assumption that any sexual orientation other than heterosexual, such as being lesbian, gay, or bisexual, or any gender identity other than cisgender, like transgender, is classed as a mental illness that needs to be suppressed or cured. Therapies could even be carried out in an attempt to make an individual act more stereotypically masculine or feminine too. These therapies are highly unethical and they've had detrimental effects on those who have had to endure these practices. In the United Kingdom, all leading counselling and psychotherapy bodies, such as the British Association of Counselling and Psychotherapy, or shortened to the BACP, alongside the NHS, have determined that conversion therapy is both unsafe and unethical. A survey in 2018 of 108,000 members of the LGBT community in the UK suggested that 2% have undergone the practice, with another 5% being offered it. The American Psychiatric Association, or the APA for short, have also dismissed conversion therapy due to there being no scientific research to back up the theory that sexual orientation can be changed. Even though it's discredited in several major economically developed countries, due to the continued discrimination against LGBT people, conversion therapy is still widely practiced in today's society. Even in countries where conversion therapy is illegal, some practitioners and unlicensed ministries still secretly conduct it. Minors are particularly susceptible to conversion therapy, and this is down to a number of reasons. One of the main reasons being the fact that their parents may disapprove of their sexuality, and this could possibly be due to religious beliefs, and they could send them to therapy against their will in an attempt to make their children more what they call normal. There are so many long-term and horrific side effects that the participants receiving conversion therapy can experience, such as depression, self-hatred, feeling dehumanized, feeling like they don't belong within their community and faith, increase in addictive behaviours, or even suicide. And that's just to name a few. The techniques used in conversion therapy vary around the world, and they've included practices such as talking therapies, like psychoanalytic therapies, counselling, and spiritual interventions, where religious leaders quite literally claim that they can pray the gay away, all of which have been recently used in the United States. Techniques previously used in the United States and Western Europe have included masturbatory reconditioning, which is a procedure that makes individuals masturbate to images or clips of the opposite sex in an attempt for them to eventually become aroused by them. Another very cruel form of therapy is chemical castration, and that involves administering drugs which reduce libido and sex drive. Aversive therapy was also used, and this behavioural therapy attempts to make a participant give up undesirable thoughts and behaviours by making them associate these things with an unpleasant reaction. So, for example, be by showing sexual images or videos of the same sex whilst administering shocks or medication that would make them throw up in order to make them associate these images with something painful or sickening. The International Rehabilitation Council for Torture Victims describes conversion therapy as a form of torture. So for hundreds of years, homosexuality, particularly between two men for some reason, was considered sinful, wicked, and was actually illegal. These views are still upheld in many global faiths, like Christianity, Islam, and Hinduism. Religious justifications for conversion therapy have been used by fundamentalist Christian groups and many other organisations. The views and opinions within religious organisations can range from quietly discouraging homosexual activity to the support of criminal sanctions like the death penalty for homosexual behaviour. However, individual religious beliefs also have had a great effect on attitudes about homosexuality, and this is particularly in countries with a strong self-expressive cultural orientation, such as the United States. The history of conversion therapy can be split into 3 memorable periods. But before we talk about history, we need to talk about Sigmund Freud. So if you've never heard of Freud, let me just give you a quick overview. Sigmund Freud was born in 1856 and he was the founder of psychoanalysis. And both his theories and opinions have greatly influenced psychology today. Now, although Freud did state that homosexuality could occasionally be removed through hypnosis, he's very doubtful of conversion therapy as a whole. Historically, there was the early Freudian period, where psychoanalysts first began trying to change and treat homosexuality. There is Eugene Steinitz, for example, who was a Viennese endocrinologist during the same period. So he transplanted testicles from straight men into gay men in an attempt to change their sexual orientation. And this obviously only applied to gay men and not lesbians, as they've got a different anatomy. So aside from the obvious ethical considerations, another issue with this method was that the immune system actually rejects transplanted glands. So it was just harmful, and it quite clearly didn't cure or change sexual orientation. In 1935, a mother asked Freud to treat her son. Freud's response to this letter later on became famous. And the start of it says, "I gather from your letter that your son is a homosexual. It is nothing to be ashamed of, no vice, no degradation. It cannot be classified as an illness. We consider it to be a variation of the sexual function, produced by a certain arrest of sexual development." And this goes to show that as Freud progressed in his career, his thoughts and his attitudes surrounding homosexuality were actually quite advanced for his time. And this was followed by the period after Freud's death, where conversion therapy was an approved form of therapy by most psychiatric establishments in the USA. And the first edition of the Diagnostic and Statistic Manual of Mental Health Disorders, or shortened to the DSM, classified homosexuality as a mental disorder in 1952. This handbook was used by healthcare professionals in in the US and most countries around the world, actually. The DSM was crucial for psychologists and doctors to diagnose their patients, so it was a very influential guide in medical history. And finally, there was the post-Stonewall period, where the LGBT community had argued for their rights and people in medical professions had started to doubt and dismiss conversion therapy as a whole. Now, Stonewall is a really important landmark in the history of gay rights. So, in 1969, there was a riot after a police raid at the Stonewall Bar, which was a gay bar in New York. Now, at this time, it was actually still illegal to be gay. So, for members of the LGBT community, gay bars were really important as they were safe spaces to hang out and meet other people. Of course, as homosexual activity was illegal, any LGBT-friendly bars became targets for the police to attempt to shut them down. This riot was between a large group of gay rights activists and the police. As this riot carried on and got bigger, it gained loads of publicity, and it actually lasted for 5 days. The Stonewall Bar ended up being set on fire by protesters. Members of the LGBT community were tired of constantly being discriminated against. And this riot, one of the first notable times when members of the LGBT community joined together and protested, attained symbolic significance for the gay rights movement. After this happened, conversion therapy came under scrutiny. Gay rights activists campaigned against conversion therapy, and in 1973, homosexuality was eventually removed as a mental disorder in the DSM and replaced with the diagnosis of sexual orientation disturbance. It wasn't completely removed from the DSM until 1987. But slowly but surely, attitudes surrounding homosexuality were improving. Well, mainly in Western society. From homosexual behaviour being decriminalised to same-sex marriages being allowed, the past few decades have seen some milestone improvements in human rights. In 2016, Malta became the first country in the European Union to ban conversion therapy completely. Following this, the German Parliament banned conversion therapy for anyone under the age of 18, which is a great start. In March 2018, a majority of 435 against 109 representatives in the European Parliament passed a resolution condemning conversion therapy and urging European Union member states to ban the practice. Since 2018, the past two Prime Ministers of the United Kingdom have given the promise to ban conversion therapy, with the current Prime Minister, Boris Johnson, stating that the practice is, and I quote, absolutely abhorrent and has no place in this country, earlier on in 2020. Now, we're still awaiting details of the ban, but he's confirmed that the government has commissioned research on the topic and they'll soon outline their plans. Now, this is crazy because this article was actually published a few days ago, so on the 16th of December, and it states that over 370 religious leaders from all around the world have called for the ban of conversion therapy. The leaders have signed this declaration and they represent all of the world's major faiths, which is a giant and significant step in the right direction. But let's not get ahead of ourselves and think too positively, as currently in 2020, only 30 out of 195 countries in the world even recognise same-sex marriage or LGBT rights, and over 100 countries actively practice conversion therapy. Several traditional religions from varying faiths have stated that they're against a ban on conversion therapy as it could infringe on their religious freedom, probably due to their deep ingrained beliefs that their gods won't accept anything outside of heteronormative. It really hurts my heart to think that gay people were, and still are in some countries, viewed in such a toxic and negative way that people have genuinely believed they needed cruel and invasive therapies in order to change and fit into society. And although it might have gotten better, it still hasn't gone away. And this is why we need to do something. We need to join together and make a change in order to completely outlaw this outdated and inhumane therapy. I know some of you out here listening are struggling to comprehend and empathise as you aren't members of the LGBT community. But what you need to realise is this isn't a gay rights issue. It's a human rights issue. And that's why we shouldn't be silenced. And instead, let's talk about it. Thank you for listening.